Thank you. I'm delighted the spotlight isn't really on the hospital at the moment, but I'm going to give you a brief update on where we are with things. Dr. Brink used the quiet word. I get told off when I go back and use that word because doctors are quite superstitious about that word, but I'm not. Just because areas of the hospital have been quiet doesn't mean that people haven't been working hard. And I'd just like to mention some of our wards have been working ever so hard throughout this entire thing. So our rehabilitation ward, the Marchant, has been full throughout the entire period. And I just think, they've been having to work ever so hard with all the restrictions about COVID that they have to deal with. So just a quick mention of that. The imaging department and X-ray departments are seeing a lot more people now. We're seeing a gradually increasing numbers through the emergency department as well. Next week we're dipping our toe in the water of planned and elective operations. It'll be a slow start because we're still taking full precautions for the personal protective equipment, and we have to do the deep clean between patients still. But we hope soon after that we can move back towards more normal working in theatre, and perhaps in a couple of weeks start increasing our flow through the operating theatres, and perhaps think about things like something we've had a lot of questions about, when partners can attend with their mums-to-be for a cesarean section, that sort of thing. So we know that's on your radar, and as soon as we can, we'll be giving you news about that when it's safe to do so. Things we always talk about, personal protective equipment. We've got at least 3 months supply in every line now, and we're seeking to increase that further because if we get a second wave, we'll be needing all of that. But we're in a good place for that at the moment. So that's more or less the hospital position. Moving on, care homes. We only have one patient left in the hospital now who's from the care homes who's still testing positive. It sometimes takes a long time, as Dr. Brink has said, for especially elderly people to completely eliminate the virus. But that's a fabulous position, and probably while we're talking now, I think one patient who's finally tested negative is going back to one of the care homes that was previously affected. So good news there, and I know the care homes will want to get their residents back to sort of more normal out of the room activities and things as soon as they feel it's safe to do so. So I'm going to say, only positive news at the moment about the care homes, which is great. Primary care continue to work closely with us. You'll remember that throughout this time I consider their input to have been exemplary in terms of how they've helped us in the care homes, how they've divided the heart clinics and worked at the chest and heart clinic doing testing with us and offering support, and we've had a lot of help from them. So we continue to work closely with them. I think that's enough from me. Thank you.
Great.